My name is Savula Stiliano. I'm the Communications and Events Coordinator for CMO, and welcome to our series of interviews with our 2021 Innovation Fund Award winners. Welcome both. Can you please both introduce yourselves?
Sure, thanks for the opportunity to speak with you today. My name is Geneviève Digby, and I'm an associate professor in the Department of Medicine, Division of Respirology, and I'm the clinical lead for the lung diagnostic assessment programs at KHSC, which is a rapid assessment clinic that evaluates patients who are undergoing assessment for suspected lung cancer.
And hi, I'm Neil Renwick, and I'm a clinician scientist and associate professor in the Department of Pathology and Molecular Medicine. And mostly I run my own independent laboratory of translational RNA biology.
Wonderful. And did you both apply as an early or established investigator?
So I'm an early career investigator, and I collaborated with Dr. Renwick, who is an established investigator in the Department of Pathology and Molecular Medicine.
Yeah, it's hard to believe it goes fast, but I'm an established investigator.
That's wonderful. And can you tell me about your proposed area of research, including the title and how long you estimate the project to take?
Sure, happy to. So the project title is Molecular Triage of Suspected Lung Cancer Lesions through microRNA-based Liquid Biopsy. So in short, it's a collaborative project that brings expertise from the laboratory side of medicine through Dr. Renwick's lab to frontline clinical care that we provide in the lung diagnostic assessment program, with the ultimate goal of improving diagnostic and timeliness of care for patients with suspected lung cancer. Our LDAP essentially looks after patients who are undergoing evaluation for suspected lung cancer, and lung cancer is a common and often deadly disease. It's often challenging to diagnose and manage these patients in a safe and timely way. And these patients undergo a series of diagnostic procedures, such as biopsies to determine if it's cancer or not, and staging investigations to determine if cancer has spread. And these can often take several weeks for patients to go through before a treatment plan can be developed. So in our LDAP program, we're always looking for innovative and new, timely, efficient ways to improve access to care, to speed up diagnostic processes, as we know that delays in diagnosis and in treatment are associated with disease progression, increased patient anxiety, and often worse clinical outcomes. So in some cases, our patients aren't even well enough to undergo invasive diagnostic testing, which can really delay and limit treatment options. So this is where Dr. Renwick's team comes in, and I'll let him speak to the innovative solution that he's going to help bring to our clinical team.
Thanks. So our lab has expertise in microRNA clinical diagnostics. And so microRNAs, these are these small RNA molecules, and they switch off gene expression. But actually, they tend to be really good biomarkers as well, because they're quite abundant. They can be cell type and disease stage specific. So they can be specific for particular types of lung cancer. And they're very stable molecules. So you can find them in tissues and in biofluids like plasma and serum. So we had a really interesting finding in the laboratory, but it's not something we can work on alone. And I was looking through all the CMO communications, and I saw that Geneviève had this really fantastic clinic on lung cancer diagnostics. And I thought, well, maybe we can combine here. So that's how we got started.
Incredible, incredible. And what does receiving the Innovation Fund Award mean for both of you, each of you?
Well, it's really an honor to receive the Innovation Fund Award, and I'm really excited that it's allowing us to build a new collaborative research network, again, between our clinical team and Dr. Renwick's lab in the laboratory medicine. As a clinician, and as it's really great to see opportunities to potentially improve diagnostic testing for patients with lung cancer. I'm really excited to explore how this might open doors for patients who are too unwell to undergo diagnostic testing, might help us optimize resource utilization to target those patients that have lesions that are more likely to be malignant. And during the COVID pandemic, we really witnessed the extent to which our diagnostic processes, such as biopsies and bronchoscopies and PET scans, they're really resource intensive and subject a lot to external influences. So a blood test that has the opportunity to help us triage patients with suspected lung cancer could really help us to focus our resources, improve access to care, and maybe even reduce health system costs and burdens. So I'm really excited as an early career investigator to have the opportunity to collaborate with somebody that I can learn a lot from and improve patient care in the meantime?
Yeah, for me, I can learn a lot too, actually. So we're very sort of specialized in microRNAs, and it's great to have the clinical expertise. So collaboration is really one massive benefit. The other thing, funding experiments is expensive, so it's just great to be able to do a relatively expensive experiment. We get to train people. So we have a lot of really wonderful students at Queen's and in the medical school, and we get to incorporate them into our program. And then lastly, we can use these types of funds to go for bigger grants. And so my lab was lucky before to get a grant. And so we managed to leverage it for Cancer Research Society and New Frontiers. And I think with this one, I'm really sort of hoping that we can leverage a CIHR out of this. So the funding is a really, really big deal.
Wonderful. Well, I certainly can't wait to learn more. Thank you both for your time. And for more information on the Innovation Fund, please visit the CMO website.
Thanks for having us.
Thank you very much.